Hello and welcome to this episode of Inside Israel. I'm Maria Mazarcher. The population of Israel is very diverse. That's because Jewish immigrants from all over the world were given Israeli citizenship. Hundreds of thousands of Israelis come from Russia, Romania, Poland, France, Germany, the UK and the US, plus different countries in Asia, Africa, and South America. But the second largest minority in Israel is its Arab population. This Arab population is native to the land and has long been the target of discrimination since the inception of Israel onto Palestine. Now, this discrimination was made even more clear due to the corona outbreak when Arabs were deprived of the essential health services. Let's take a look.
Secret that in Israel, the resources are not equally distributed. The indigenous Arab population of Israel says that the Israeli regime took no precautions against the coronavirus in their towns that are spread across northern Israel. Arab Israeli lawmakers have been calling for expanding coronavirus testing for Arab Israelis. They complain of severe undertesting in Arab communities. So far, according to Israeli media, there have been over 600 confirmed COVID-19 cases among Arab Israelis. That is roughly 4% of the total infections in Israel. But it is unclear if the relatively low number of reported infections is due to a lack of testing or if the virus is less prevalent in these communities for other reasons. Two Arab Israeli communities, including Deir al-Assad and Benai in Israel's north, were restricted areas due to concerns of a possible coronavirus outbreak in their vicinity. In fact, many point out to the fact that Arab areas such as the northern city of Haifa were not taken care of. They say that wild boars and other wildlife would attack pets and even block roads. Some can even put residents in health risks.
During the corona crisis now, it's becoming more and more terrifying because animals, as you know, carrying disease, and they are all around here, and we are terrifying that they will bring us corona or other disease.
Corona, they become more and more habitant. They used to move in the streets without any disruption. And I'm afraid that after this corona virus will pass, they will used to come every day and every night and every hour all over the year, much worse than it was before.
Israeli military forces from the Home Front Command have moved into the area to oversee the lockdown of these two Arab Israeli communities. The Arab Israeli communities are sensitive to military presence in their towns because it was these very same Israeli soldiers who forcefully took over their land and declared it to be Israel back in 1948. According to the Taub Center for Social Policy Studies, Israel's health services are harder to access for the Arab population. Arab towns are located, on average, nearly twice as far from hospitals as Jewish towns. Early on in the pandemic, it became apparent that fewer coronavirus tests were being administered among Arabs. Vital informational material about COVID-19 wasn't even available in Arabic until recently. Israel has closed all doors for allowing any input from Arab public health professionals for its coronavirus policy.
But what is the reason behind targeting this minority? Why were they deprived of the required health services during the outbreak? And how were the lockdowns that prevented them from being tested justified? This next exclusive case study will answer these questions and more.
Well, the problem here is we have to look back to 72 years ago where everything has begun, Israel has begun. Israel, since its first day, she has declared that the relationship between the Arab and Israel and the Jewish, sorry, should be not a citizenship relationship. It's an honor and some kind of extra type of slaves relationship. We can say it's like that. So that's why all the resources, when the authorities has to give it to communities, and Israel has lots of communities, even among the Jewish, even among the Jews. She has lots of communities, and she not do it equally, even among the Jews. Once again, not just among the Arab, even among the Jews. When we are talking about the Orthodox Jews or or the Mizrahi, maybe also the Eastern Jews, we are talking about not equal. So yeah, Israel is based on some kind of apartheid ideology. Let's go back. In the first days of the coronavirus disease in Israel, there was something like 1,000 patients, and only 5 out of them were Arabs. We're talking about 0.5%, where the community itself is just about 20%. So in the first days, I said there's something is not going as well. There's something with the test that should be more and more. And Israel, although all of this, Israel decided to do all the tests first of all, among the first-class communities, like in Tel Aviv and Haifa, Jerusalem, Beersheba, and then she came to the periphery. After that, she decided to do the test among the Arab community, and also among the Orthodox Jewish communities. So, we are talking about 1 month ago, and in this month, the size of the disease, we just bomb out in the face of Israel. Well, also the lockdown came a little bit late into the Arab community. In the first, the Arab citizens took their information all about the lockdowns and all about what's happening among the country from both type of media. One of them was the new media, and all what is going on the social, and they got the information about what's going in the Arab countries and how everything is going over there. And the second type were from the Israeli mainstream media, and but none of them talk in Arabic. The mainstream media in Israel didn't speak in the beginning, didn't speak in Arabic, and didn't speak even to the Arab community. So the lockdown came a little bit late. There were no the right campaign who spoke in Arabic, even it came a little bit late. So all of this just make a lot of disinformation among the Arab community, and that's why the lockdown even came late.
Author and political activist Gilad Atzmon joins us from Athens for more on this sensitive topic. Welcome to the show, Mr. Atzmon. Now, hundreds of thousands of Israeli Arabs have suffered the regime's neglect during the corona outbreak. Can you tell us the reason for that?
This is quite obvious. Israel is the Jewish state. It is prioritizing its Jewish population, and Israel is also a multi-layered society, so the Arabs are not even second-class citizens. They are like 9 or 10 or 12 class citizens. Ahead of them you have the Moroccan Jews and the Sephardi Jews and maybe the Ethiopian Jews. It's a very problematic society, and the Arabs are certainly coming at the bottom.
Well, discrimination against the Arab population in Israel is nothing new, but Where does it stem from?
This is hardly surprising that people who are engaged in terror and terrorizing their own citizens are projecting their own symptoms onto their victims. The Arabs in Israel, Palestinians, and the Arab Palestinians who are Israeli citizens are subject to constant Israeli terror. And what we see is Israeli politicians projecting that kind of symptoms or that kind of behavior. They are attributing their own characteristics to the Arab citizens.
And can you tell us just how far can this Arab-Israeli population go without being restricted by the authorities?
I don't hold my breath. Israel is a hardcore right-wing state. In the Jewish state, there is not a single proper left-wing party except the Arab United List. I, for many years, have been arguing that Jewish left is an oxymoron, and it's very easy to explain. Jewishness is a tribal concept. Left is supposed to be a universal concept. Tribalism and universalism are like oil and water. They don't mix. This is why left has literally disappeared in Israel, and the only left that is left there is the Arab left and the Arab list, the Arab United List. And we shouldn't expect this to change.
Well, thank you for that, Mr. Atzman. That was author and political activist Gilad Atzman from Athens. Now, what do other Israelis know about the Arab population? Coming up after a short break. Now, how well do other Israelis know the indigenous Arab population? Are they aware of the issues facing this large minority? And what do they know about the most recent incident of discrimination against Arabs in terms of health services during the pandemic? We asked Israelis these very questions, and here's what they replied.
لا ما كانش في تساوي ولا كان في فحوصات متساوية، بالعكس يعني كان الفحوصات بالمناطق اليهودية كانت أكثر منها، عشان هيك بين في أكثر كان كورونا مش كورونا، بينما بالمناطق العربية كانت ضعيفة كثير، وحتى أقول لك إنه ما كانش في 10% من الفحوصات بالمناطق العربية، عشان هيك بين إنه في فرق كبير بيناتهم، لما بلش يفحصوا بالمناطق العربية بين في كورونا، أما ما كانش في توازن، وتأشي الصحة كانت هي يعني ضعيفة كثير، هاي وزارة الصحة كثير ضعيفة.
عربي المضبوط من بداية الفيروس كان الاهتمام كله بالمناطق اليهودية، أما بالآخر بلشت تنكشف عند العرب، لأنه العرب تعرفي ما كانوش واعيين لهذا الموضوع، وبقول لك فيروس عادي، مش متوعيين لهذا الموضوع بالشكل المضبوط، واللي تبين إنه بالآخر صار يبين عند العرب أكثر، وصارت عند العرب في كثير مرضى فيروس كورونا
متأخر. يعني مثلا معلمة بتكونش عندها بتفوت بتعدل كل عرس نفس الشيء، يعني كثير كان شيء متأخر.
حسب رأيي الحكومة تعاملت مع الإشي من ناحية مادية وبس، مش ما أبدتش اهتمام بصحة المواطنين. ما شفناش يعني إنه عملوا فحوصات أو حطوا الناس مسؤول إنه عن هاي الإشي أو كيف تنظم هذا الإشي أو تمنع. لا بشكل عام أنا بحكي عنا يعني كبلد، إنه أنا ساكن من كسال، ما شفتش إشي ببلدنا يعني عملوا إشي، وحتى لو إذا عملوا كان الإشي كثير متأخر بالنسبة لمحلات تانية.
Now, despite the ongoing discrimination against Israel's indigenous Arab population, these people have made significant contributions to the healthcare industry. In fact, Israel's doctors, pharmacists, and nurses mostly hail from the Arab population. And though they served Israelis of different backgrounds during the outbreak, the members of their own community were not given the necessary access to the same facilities.
This type of policy from the Israeli regime comes amidst the fact that Arabs have a large presence in Israel's medical industry. Arabs make up only a fifth of Israel's population, or 20% of the population of Israel. According to official Israeli data published in the daily Haaretz newspaper, Arabs make up 17% of Israel's doctors, 24% of the nurses, and 48% of the pharmacists. For the indigenous Arab population of Israel, attaining professional qualifications has been one way to push back against political marginalization. It is meant for them as a way to stifle land, social and political takeover of their land. Without the decisive contribution of Arab medical staff, the current Israeli healthcare system would collapse. For decades, Israeli leaders have denigrated Arab politicians as supporters of terrorism, stripped Arabic of its status as an official language, and in 2018 passed a law that gave Jews alone the right to self-determination in Israel. But in the battle against coronavirus, the Israeli regime needs their help. But this doesn't mean reconciliation. Just recently, Israeli Prime Minister Benjamin Netanyahu told Israelis against an alternative cabinet that would include or rely on the joint list, that is the Arab Alliance of Political Parties, which the Prime Minister and his allies portrayed as terrorism supporters. Netanyahu and his right-wing political allies declared that Arabs were ignoring health directives. But despite such claims, none of the Arab-majority cities, even the densely populated neighborhoods of occupied Jerusalem Al-Quds, have not had major outbreaks.
Eric Wahlberg is a journalist and the author of the Canada-Israel Nexus. He joins us now from Canada. Great to have you with us, Dr. Wahlberg. Now, let me ask you this. What is the current living situation of Israeli Arabs? And also, have they always been treated this way?
Of course, the problem in Israel is that the Arab Israelis are second-class citizens. That is the clear situation. They don't have the same rights as Jews, and they are generally poorer. They have to work in more menial jobs that the Jews won't do. So that, and they also are therefore in public working in situations where they can't be socially distancing. So this is a problem. So, and also hospitals are twice as far away from where Arabs live than where Jews live. So there are there's basic discrimination that's built in to the system. And whether or not the doctors want to be working more closely with Arabs, they face this problem that there are these basic discrimination elements within the society. So that is the basic problem here with them.
Well, we do know that Israeli Arabs are the main caregivers in the healthcare industry. So why is it that the same community were not taken care of during the corona outbreak?
Well, yes, they are not, they don't have the same easy access to medical care. They have equal rights, but the actual ability to observe their rights is not really there because of the innate, the problem of access to hospitals, the fact there was nothing in Arabic. There was no information provided in Arabic about the corona epidemic until last week. Finally, there was an announcement or an ad that was in Arabic. So that shows you how backwards the Israeli response has been. But it shows you that it did come into effect. So the Arabs are getting better access now because, of course, the coronavirus doesn't discriminate. But it's also interesting that there are far fewer corona cases among the Arab Israelis. And that is because the Arab Israelis, they don't travel very, very little abroad. Of course, the Jewish Israelis are traveling all the time to Canada, to Europe. And then they bring back the virus and they don't see Arabs, they just see Jews. So they're infecting each other. It's kind of, there's a nice irony, not a nice, but there's an irony there that the discrimination has actually made the coronavirus much more lethal to the Jews than to the Arabs.
And about the new unity cabinet, how is it going to impact recent political gains of the Arab community?
Well, of course, this unity regime, it's a complete farce. It's basically all the Zionists together, whether they hate each other. I mean, obviously the Netanyahu and the Benny Gantz, they really don't like each other at all, but they're joining hands against the Arabs. That's what, and against the Palestinians. It's really disgusting. But it's wonderful in a way that this coronavirus is showing the real heroes of Israeli society are the Arabs. And the whole world, Christian Science Monitor, you can go to, I'm sure the New York Times has written positively about the way the Arab Israelis are on the front line. So I think this will really, really push the cause of the Palestinians and the cause of the Arab Israelis. And we can't count on Netanyahu to do anything. What we've got to count on is world opinion and our efforts, our joint efforts to highlight and to make the truth of the situation clear so that the Arab Israelis really get more of a good shake.
Well, thank you for joining us, Dr. Wahlberg. It's now time to look at the news making the press in Israel. Vynet. A new survey says that majority of Israel's Jews oppose West Bank annexation. According to the poll, only 25% of the Israelis say they would support a potential annexation of occupied Palestinian territories. The Jerusalem Post. Israel's finance ministry is forced to expand its crisis budget as Tel Aviv feels the heat of public unrest and rising costs for the regime. Haaretz. In a new development against anti-Netanyahu protesters, Israeli regime authorities have questioned several of the leaders of the protest movement for alleged threats to Netanyahu's son. I-24 News. A new report says that Israeli police is running a massive under-the-radar vehicle tracking program. According to the report, the police is collecting footage from smart surveillance cameras. Authorities claim that this helps identify stolen cars and expired driver's licenses. Critics say, however, that this surveillance can be used to target political opponents. The Times of Israel. Half of Israelis say the financial situation is worse as a result of the coronavirus lockdown. Around a third of Israelis have reported feelings of stress due to the economic situation, while 14% said at least one member of their household had to cut down on food or skip meals since the start of the pandemic. Thank you for following us all the way to the end. We hope to have helped shed light on the plight of Israel's indigenous Arab population. Now, the more individual stories we hear from you, the more we have to share. So get on presstv.com and tell us about your very own experience. See you next time.